4 things you need to get pregnant. You need to have an egg released every month from the ovaries. You need to have tubes that are open because that's where the egg and sperm meet and fertilization takes place. And you need to have sperm to meet with the egg. And then you definitely need a uterus for that, that's normal in shape and appearance for that fertilized egg or embryo to implant in and for the pregnancy to grow. So we do a bunch of different tests to make sure that there are no issues with any of those 4 things. And so your doctor might order various different tests. For ovulation, we might be doing blood tests, which include tests on the 3rd day of your period. So that includes hormone levels such as FSH, LH, estradiol, TSH, and prolactin. And we also might do a blood test on day 21 of your menstrual cycle, and that's to check for ovulation as well. Sometimes we might do other tests looking for other hormone levels like androgens or the male hormones to make sure that those are okay. We might be looking for ovarian reserve markers as well. So that's a measure of how many little follicles or eggs there are in the ovary to tell us how likely we think someone is going to get pregnant, especially with fertility drugs. So that might be a blood test, which could either be something called an AMH or anti-Mullerian hormone level, and that can be done anytime in the menstrual cycle. That day 3 blood work, where we look at the FSH levels, also a marker of ovarian reserve. And when that's really high, that tells us the reserve is low. Another test too is an ultrasound that we might do. It's a transvaginal ultrasound down on the 3rd day of your period, where we measure the antral follicle count, or the number of little eggs in the ovary. We'll also do testing to make sure that the fallopian tubes are open. So there are different ways we can measure these tests. Commonly we'll order a sonohystogram, and this is an ultrasound test where we inject fluid up through the vagina, through the cervix, into the uterus, and then flush it through the tubes. It's a saline solution of salt water and air, and we watch with a transvaginal ultrasound to see the fluid going through. It can also check the cavity of the uterus at the same time, which is nice. Another test that we do is an HSG. That's when we use contrast dye that goes, again, through the vagina and cervix, into the uterus and out through the tubes on both sides. And this is done while taking x-rays. So we typically do it in the radiology department in the main hospital. There are other tests as well. A laparoscopy, which is a surgery, is the gold standard test for checking tubes, but we don't often need to do this in many situations. And that's when a camera is put in through the belly button. The abdomen is extended with gas, and we look inside the abdomen to check that the tubes are open while we're pushing dye in through the vagina and cervix. Another test that we might order is a hysteroscopy, and this is a test that's done through the vagina and cervix to look inside the uterine cavity. It doesn't check the tubes at all, but we actually put a little camera inside to look at the uterus itself to make sure that there are no polyps or fibroids or anything that might be affecting the ability for a pregnancy to implant in the uterus itself. To check for problems with male fertility, we'll be asking every male to produce sperm test. That's a semen analysis. And depending on those results, we might do further testing as well. So the sperm test will measure the concentration or the number of sperm, the motility, how many are moving around, and also the morphology, the number of normal-looking sperm. If there are abnormalities in that, we might sometimes ask men to do further tests, and that include blood work, which checks, again, the hormone levels, and as well as some other sperm tests or possibilities. And sometimes that we'll refer people to the urologist for further workup as well, and occasionally some genetic testing might be indicated. The other testing we'll do is for viral blood work. And so all men and women seen in the clinic who will be doing any fertility treatment need to be checked for HIV, hepatitis B and C, syphilis, and we also check women for rubella and varicella immunity as well. We often find that there's not just one cause for infertility, there's often many times. Generally, we quote of a 35% risk of male cause for infertility and also a 35% risk of a tubal cause for infertility. Less common causes are problems with ovulation, which tends to be in about 15% of cases. In 10% of cases, we don't find a cause. We consider it to be unexplained infertility. And about 5% of the time, it's an unusual reason for infertility. Depending on what the cause of the infertility is, there are different treatment options. So for women who are having difficulty ovulating regularly, we often give medications to make those women ovulate, and often they can just have timed intercourse related to that. So those vary from pills such as clomiphene citrate to injectable medications, and on occasion surgery as well, and sometimes IVF. For male factor, we look at the different treatment options include intrauterine insemination, or IUI, in vitro fertilization, IVF, with ICSI, which is called intracytoplasmic sperm injection, and sometimes donor sperm needs to be used, and sometimes sperm extraction procedures to take the sperm out of the testicles or epididymis. For unexplained infertility, the treatment options are typically controlled ovarian hyperstimulation with intrauterine insemination or in vitro fertilization. For tubal factor infertility, the mainstay of treatment is in vitro fertilization, and sometimes we're able to do fertility surgery to help open up the fallopian tubes.